Greetings and welcome to Week 5 study or the review for midterm. Um, what we've studied so far, we've learned to differentiate between word elements, things like root words, prefixes, and suffixes, and how these elements are used to construct complex medical terms. For instance, let's look at the word dermatitis, or infection of the skin. Itis is the word part for inflammation, inflammation of. Dermat, skin, so inflammation of the skin. Before I continue with this, I want to emphasize that a lot of times there are many different factions of the same thing. Now, there are many different types of dermatitis that'll have an effect on how you code for the information. Now, an example, I'm going to give you the ones that are most common. And there are a lot that are not that common, but they're not something that we code all the time. It's just an occasional thing. Excuse me. Let's start with atopic dermatitis. Okay, atopic dermatitis is an allergic disease believed to have hereditary components, and it often runs in families whose families have asthma and things like that. It's like an itchy rash, which is particularly noticeable on the head and scalp, neck, inside the elbows, behind the knees, and buttocks. And it's very common in developed countries, and it's rising. We have more and more allergies that we have to contend with these days, and allergies set off those of us who have asthma or who have had asthma as children, and there's just a lot more stuff that we're becoming allergic to. As I said, it's very common in the developed countries, and it's rising. Irritant contact dermatitis is sometimes misdiagnosed as atopic dermatitis, so you have to be particularly careful. Contact dermatitis has two types. We have allergic, which is resulting from a delayed reaction to an allergen, such as poison ivy, the nickel and silver jewelry, or even balsam in Peru, or from Peru. It's an irritant resulting from direct reaction to a detergent, such as, for instance, myself, I'm allergic to Tide. So what we're allergic to is sodium lauryl sulfate, and that's just an example. There's lots of other stuff that's in there that we could be allergic to as well. Some substances act both as allergen and irritant. Wet cement, for example, would be react as an allergen and an irritant. Other substances cause a problem after sunlight exposure, bringing on what's called phototoxic dermatitis. Now, about 3/4 of the cases of contact eczema are of the irritant type, excuse me, which is the most common occupational skin disease. Contact eczema is curable, provided the offending substance can be avoided and its traces are removed from your environment completely. And you find out about this in ICD-10. It's L23, L24, L56.1, and L56.0. Now, we're talking about eczema. Do you have or what we call xerotic eczema? It's dry skin that becomes so serious that it turns into eczema. It worsens in dry winter weather, and a lot of times the limbs and the trunk are the most affected areas. The itchy, tender skin resembles a dry, cracked riverbed. I mean, it's how a riverbed looks once it's dried out. Um, and this disorder is usually more common in the elderly or older population. We also have related disorders like ichthyosis, or ichthyosis. Uh, we find this in ICD-10 L30.A and L85.0. We also have seborrheic dermatitis, or seborrheic, what we call cradle cap, and it's usually in infants. It's classified as a form of eczema that's closely related to like dandruff. It causes dry or greasy peeling of the scalp and the eyebrows, on the face, and sometimes the trunk itself. In newborns, it causes a thick, yellow, crusty scalp rash called cradle cap. And it seems to be related to the lack of biotin, and it's often curable. We would find that in ICD-10 L21 and ICD-10 L21.0. And there are many more that are not as familiar, that you may have to code. Let's get back to medical terms. Now, medical terms are constructed from word parts, including root words, prefixes, and suffixes. Now, root words are the basic building blocks of medical terms, and they can be combined with other root words. When two root words are joined together, a combining vowel is used between them. Root words also may be joined to prefixes and suffixes. Let's take, for instance, you have hysterectomy, which is surgical removal of the uterus. You have a hystersalpingoectomy, or hystersalpingectomy, which is removal of the uterus and the fallopian tubes. Then we have the hysterosalpingoophorectomy, which is removal of the uterus, the tubes, and the ovaries. And if you notice, when we sounded those out, each one had a 0 in it. Now, oophorectomy starts with 0, and there's 2 of them because OO stands for egg. So in a case like that, we have to hyphenate. So it would be hysterosalpingo-oophorectomy. Now, these words parts can either provide more specific meanings to the root words or change the meaning of the root words to convey specific meanings. You need to recognize and define commonly used eponyms, abbreviations, and acronyms as you're studying through this. Medical terminology also includes eponyms, acronyms, and abbreviations. Eponyms are names of diseases or body parts that are derived from a person or a place associated with that particular disease, or the body part itself. Acronyms are usually constructed by using the first initial of each of the multi-word term. Uh, and sometimes we use a shortened version of a word like catheter. We use CATH. Cancer, CA, capitalized. Now, there's some that you never, shortened versions that you never use, and some that you use a lot. Such as in, identifying anatomical structures and the systems which they belong to, where they're at, and on the quadrant grid. So you really need to know anatomy and physiology for coding too. You have to know this stuff. You can't just, it's not just, here's the word, let me look it up. You have to know, because you're going to have to look at several different things to get one answer. Now, anatomy and physiology is very important in the selection of correct codes, as I just said, describing diagnoses and procedures. Both the ICD-9-CM manual and the CPT manual list procedures are organized around body systems. And coders must be able to identify the organs involved when particular services are provided. ICD-9 diagnosis coding systems replaced with ICD-10 coding system in 2013, but not everybody's completely adapted it yet. ICD-10 includes more than 69,000 diagnoses codes. Many times the number of codes in the current ICD-9-CM system. Now, the use of more detailed medical terminology allows diagnoses and conditions to be described with greater specificity than it can be done using ICD-9. The 30-year-old ICD-9 code system is really inadequate to convey all the diagnoses information that we currently have available. I mean, we have new therapies every day. We have new surgeries. We have new diagnoses. Excuse me. So it's growing. In 2013, and when they added a new coding system, ICD-10, it included approximately 5 times the number of diagnosis codes as ICD-9. Each code had more information embedded in the code itself. There's no universal mapping system to convert ICD-9 to ICD-10 codes. We have general equivalence mappings, which help you help coders identify new codes that describe the conditions as the older codes did. Excuse me. ICD-10 CM codes consist of 3 to 7 digits. The first digit's always an alpha character, A through Z. The second digit's always numeric. The third digit's either alpha or numeric. If the code consists of more than 3 digits, a decimal point always follows the third digit, with the remaining 1 through 4 digits following that decimal point. The digits to the right of the decimal point may be alpha or numeric digits. They contain information embedded in the code that's not always available, as we said, in ICD-9, including information regarding laterally, what we say call laterality, pregnancy trimester, and whether the encounter was for initial treatment of an injury, subsequent visits, or to treat sequelae of the injury. ICD-10 includes the alphabetic index and tabular list to help coders select most appropriate code to describe the conditions. Now, the tabular is divided into 21 chapters listing more than 69,000 codes. Coders should use the alphabetic index and the tabular list in the same manner as they currently do ICD-9, or currently use the Volume 2, followed by Volume 1 of the ICD-9. The ICD-10 CM conventions and general guidelines are similar to those of ICD-9. The differences that do exist are not very difficult for coders to understand and adapt. ICD-9 Volume 3 procedure codes are not a part of the ICD-10 system. Instead, you've got a completely new procedure code system. It's called ICD-10-PCS. This includes approximately 87,000 codes that will be adopted or were adopted at the same time as ICD-10, or will be adopted if you haven't already adopted ICD-10 in the office or wherever it is that you work. ICD-10-PCS codes are also 7 characters in length, but they have rules of construction that are significantly different than those governing ICD-10-CM Volume 3. Coders will need to devote some time to mastering that format and selection of those codes. So you're going to have to work a little bit harder for that. If you've already been coding some in an office you're working in or what have you, and you're still using ICD-9, there's going to be a little learning curve there for you. You're going to have to learn, study a little harder on that. The CPT manual is divided into 3 separate categories describing Category 1, 2, and 3 codes. Category 1 is divided into 6 main sections. Now, some of these sections are further divided into smaller sections, and each section includes guidelines that provide instructions for selecting codes from that section. Coders should select the code that corresponds most accurately to the service provided, and if no code describes a service, an unlisted procedure code can be reported. CPT codes include information essential to determining which code should be selected to report the services, including indented formats in the code descriptors, symbols, parenthetical notes, modifiers, and identification of separate procedures. The CPT manual includes information other than that provided with the individual codes, including the index, the appendices, place of service codes, and lists of common abbreviations that are found in the healthcare record. Category 2 identifies performance measures that may be used to measure the quality of services provided by the individual providers, large group of providers, or even the healthcare systems. These codes are organized according to the types of services measured. If several modifiers may be attached to Category 2 codes to indicate that the provider did not provide the measured service for a reason that allows exclusion from the denominator of the measurement calculations. Category 3 codes identify emerging technologies, which are defined as new devices, services, procedures, or new applications of existing technologies. These codes usually are added in numerical order without any particular organization. It's improper coding to report a service with an unlisted Category 1 code if a Category 3 code describes that service. Category 3 codes usually remain in effect for 5 years. After that time, the utilization of these services is analyzed to determine whether that technology has been sufficiently adopted by medical providers, and if so, a new Category 1 code might be adopted to describe the service. If the Category 3 code is deleted without a new Category 1 code, the service may continue to be reported with unlisted Category 1 code. I hope that I've given you a good little go over of what you need. Just make sure you study everything that you've done, your discussion questions, your assignments. It all will come together and help you be successful with your midterm exam. As always, if you have any questions, please contact me by email, by cell phone. As I said, I sign on several times a day just to make sure that I'm not missing anything from my students. So, and of course, my cell phone I check constantly. So, you're covered no matter which one you use. So, thank you, and have a great week, and study hard as usual. You will become successful.